ADANSI is a non-profit association of families and people with autism spectrum disorder from the Principality of Asturias, located on the northern coast of Spain, declared of public utility. In collaboration with the HCI Research Group at the University of Oviedo, we have developed a project for early detection and care of autism, the Your Baby's Gaze Project, and based on her publication on the autistic brain, A Different Gaze. For 8 years, we have carried out complementary clinical assessments and recorded the gaze patterns of 1,139 boys and girls from 6 to 36 months old, of which 549 have been diagnosed with ASD. With this data, we have managed to develop POCTI, the prototype of the first objective early screening test for ASD, autism spectrum disorder, using artificial intelligence. With this test, it is possible to objectively detect autism warning symptom in babies from 9 months of age. The warning indicator is the presence of the different gaze pattern objectified and quantified in the first part of the project, Your Baby's Gaze. Babies at risk of autism pay more attention at objects than at people, make fewer exchanges of social information gathering, and do not look in the direction the adult looks and points. This is a very easy test to apply. It does not require the help of an autism specialist, and the only thing required of the baby is to sit in a high chair or on an adult's lap and fixate on the screen. The eye-tracking device will record the baby's gaze fixation points on the screen, and the software developed will allow the visualization and quantification of the baby's gaze pattern. Visualizing differences in eye pattern.
¿Estás ahí? Sí, estás ahí. Hola. Cucú. Hola. Hola, hola.
The introduction of the numerical figures obtained by the baby, tabbed separated values data, into the designed application will activate the ASD, non-ASD classification algorithm, and will offer a negative or positive result. The negative result will mean that the baby does not present ASD risk indicators. The positive result will mean that the baby presents ASD risk indicators and should be referred to a specialized service to implement a specific preventive intervention program as quickly as possible. At this time, it works with an average accuracy of 91%, sensitivity of 80.7%, and specificity of 96.1%. This means that out of every 10 cases, 0.6 false positives or 2.5 false negatives could be issued, and these false negatives would correspond mainly to the T1 profile. Although these values are already sufficiently robust to validate it as a screening test, the option of entering the clinical decision once the test has finished has been added to POCTI, that is, confirming or correcting the result issued by the classification algorithm by the autism expert. With this option, the algorithm that uses machine learning is also periodically retrained with confirmed cases, with the aim of improving its performance over time. Early detection and action reduces the symptoms of autism, reduces the need for support, and reduces the social cost. The estimated prevalence of autism in Europe is 1 in every 100 births. The Center for Disease Control and Prevention in Atlanta points to even higher figures, 1 in every 54. The average age of first suspicion of the disorder, according to the Autism Confederation of Spain, is 22 months, and the average age of diagnosis is between 3 and 4 years of age. With the Your Baby's Gaze project, ADANSI has developed preventive action programs from 9 months of age and has shown a reduction in the symptoms of the disorder. On the ADANSI website, adansi.es, you can access detailed information on the development of the project. Our ultimate goal is to achieve the introduction of POCTI as an early screening test for autism in the health system. We would appreciate your opinions or suggestions about POCTI and also possible support or collaboration to continue its development. Thank you.
Is a different gaze pattern an alarm indicator of autism? The explanation is in the second part of the video.